CAR T is fascinating. What it does is it's that principle of using the immune system. So we believe that in cancer, and particularly in some of these lymphomas and leukemias, that they evade or get around the immune surveillance, and so that is what lets them grow out of control. So we kind of try to play on the immune system and capitalize on it. We take a patient's own T cells. T cells are the cells we think about as perhaps keeping cancer in check. They're also the cells that we think keep infections in check. And we basically take those T cells out of the body. They get sent off to a lab where they kind of get manufactured, mutated. There's a lot of different words we can use to learn how to attack a specific protein on the surface of the B leukemia cell or the B lymphoma cell. Once those cells are kind of mutated, grown to an adequate number, they actually come back to the facility where the patient is being cared for, and they are ready then to administer as basically what we call a live medicine or a live product. We put those back into the patient, into their bloodstream, and our hope is that they will go find that cancer, almost treat it like an infection, attack it, and then ideally put that cancer into remission. How do we get the CAR T cells and how do we put them back so that they can do their job? We actually put the patients on a machine that effectively makes them their own blood donor. So if you imagine a healthy volunteer giving red blood cells or platelets, in this case, imagine the patient being their own blood donor, and in this case, they get hooked up to a machine that pulls out blood, takes away their T cells, and then returns the rest of their blood into them. Those T cells are then sent off to these specific pharmaceutical companies that manufacture these CAR T products, and then those end up coming back to the facility where the patient's being treated, and then they actually come back as a frozen product, just so we don't lose viability. But we thaw those right at the bedside, and then we reinfuse them and put them directly into the blood, where then they take over and kind of do their thing throughout the body.